We're going to go ahead and get started. Again, thank you for joining us today on the webinar. My name is Andre Bailey, and I am the CEO and founder of Project Opioid. Our webinar today is going to be focused on how your community, and we're represented today with communities around America. We've got mayors, county leaders, sheriffs, law enforcement, hospital presidents, United Ways, you name it. We have top leaders from around America today talking about this terrible overdose crisis and how communities can use resources to impact the crisis. Again, I'm the founder and CEO of the nonprofit that's putting this webinar on, Project Opioid, and you'll be able to get my information later and get a hold of me. And so thank you so much for allowing me to host today. Let me introduce some folks who are also going to be participating in today's webinar. We have Dr. Kendall Cortelyou, PhD. She is the Director of Data and Analytics and Strategy for Project Opioid. She's also an associate professor at the University of Central Florida. So if you see data here today and have questions about it, you can reach out to Dr. Cortelyou, and we're excited to hear from her in just a few minutes. We also have next a good friend of mine, Harry Nelson is on today. Harry is the founder and managing partner at Nelson Hardiman LLP. He is also the author of the book, The United States of Opioids. This book was released about a year before the pandemic. And so Harry's going to contrast today the opioid crisis from before the pandemic to now after the pandemic. And he also is going to update a little bit on some of the lawsuits and what those lawsuits will mean for resources in your community. New money might be able to help more people in need. Also, we've got Chief Tom Synan, Chief of Police of Newtown, Ohio. Chief Tom is one of the best in the business when it comes to mobilizing leaders and using leadership at a regional community level to make sure that folks stay alive and make sure that they get help if they're struggling. You're going to hear a lot from Project Opioid both today and in the future about something we're calling the Overdose Initiative. This is a new national model that we are behind, asking communities to come together with their top leaders, look at data, and implement what we believe are the 12 focus areas that can save lives. Chief Tom is someone who has been doing this a while, and so we're going to hear from him as well. Next, if you also have questions, make sure to put questions in the chat panel. You can email us directly at Project Opioid, but if you have a question, go ahead and pop it in the chat, because we're going to try to answer as many questions as we can today before we end this webinar. Next, so let me just set the stage a second. Let me set the stage. You can go to the next slide and talk a little bit about Project Opioid and where we're at with overdoses in America. Again, Project Opioid. What is Project Opioid? We're a nonprofit that looks to work with community leaders like you on not just what needs to be done, but who must work together in a region at a community level, and then how those leaders at a community level can put these things all together and implement strategies that save lives. So Project Opioid is a community collective impact initiative that has a large footprint in about 7 communities in America, looking to expand by the end of this year to over 100 communities that have coalitions working together on this crisis. Next, please. When we think about, many of you have heard Project Opioid talk about our Overdose Initiative. We've talked to you previously. For some of you, this is your first time interacting with Project Opioid. We talk a lot about what we call the Overdose Initiative. You're going to be hearing a lot about this in our May 19th national webinar and in other webinars we do this summer. But the Overdose Initiative is about community impact. Next slide. It's really about how community leaders across America can work to solve this crisis. We've got a lot of Project Opioids in certain parts of our society, certain states, but now we're expanding beyond that. So when you hear about the Overdose Initiative is not about us, it's about you and how we can help empower your leaders to transform lives. Next slide, please. So Overdose Initiative, I'm going to talk about this really briefly, then we're going to dive into data with Dr. Cortelyou. Again, how do we build leaders, business leaders, faith leaders, government, our universities, our healthcare, all our advocates. How do we build a coalition that can drive change? How can we get that coalition to have the right data? And then how do we implement solutions that save? Listen, there's one thing I want to also stress. Your community is probably doing some work on this crisis. That's why you're on this webinar. But we are passionate about adding some real leadership muscle to all the coalitions that currently exist so that you can have the most resources and the most leadership and manpower to drive this crisis. So that's the Overdose Initiative. You'll hear a lot more about this in the future, but just wanted to share that with you. Next slide, please. So in addition to the Overdose Initiative, I want to explain this part of it really quickly. Why do we believe it's important to have a coalition of leaders working together? This is one premise I want to stress. Next slide. It's important because we believe government by itself will struggle, but leaders together can create opportunity and drive resources. These are some of the images from Project Opioid initiatives happening around America. Again, driving advocacy, driving the conversation, bringing together mayors, county leaders, law enforcement, the business community, the faith community. That's what we're all about. So thank you again for your participation today. And we are going to encourage you. Our whole idea behind Project Opioid on a national scale is about you and how you and your leaders in your community can come together. Next slide, please, because at the end of the day, we've got to look at new ways of impacting this crisis and bringing people together to do it. This is a risk continuum that Project Opioid is going to be talking to you about in your community. What is your strategy and how can you impact the most lives? Next. All right, so what does a community look like working together? It looks like creating funding priorities, goals and scorecard, and a continuum of care that impacts people in need. Next, please. And as I said, we're going to hop into the data in a minute, but one of the premises of this work is that if you're a mayor on this webinar, if you're a county leader on the webinar, if you're a sheriff, if you're a chief of police, whoever you are, and you work in government, I want you to know we need to support you, and government by itself is going to struggle to solve this crisis. Project Opioid's model says bring business, faith, philanthropy, and others. Work with government. Government's going to have some resources, and this is how we're going to be able to make an impact. Next, please. And as we move on to the data, Project Opioid is also really about advocacy and bringing this message that fentanyl is now a death sentence in a way we've not seen before. So these are all the aspects of Project Opioid we wanted to share with you. And over the next few months on our webinar series, we're going to help you in your community bring coalitions together, do advocacy, and implement solutions that save lives. Next, please. Next slide, please. All right, so let's preface where we're going now with saying that this was just 2 weeks ago. New money is coming in. J&J just settled their lawsuit. We also have seen new drugs, new money and new drugs, fentanyl, and new, more powerful versions of synthetic opioids like ISO. We saw the West Point cadets in Florida overdose on what they thought was cocaine, and now that has turned into another example of this incredible rise in synthetic opioid deaths. Drugs are becoming more and more deadly. We're seeing an amazing increase in overdose deaths fueled by these synthetic opioids. And now drugs are changing. And ultimately, everything on your streets is becoming fentanyl in one form or another. Next, please. Again, as we move on, please put questions in the chat box. We're very, very, very interested in your questions. And so without further ado, next slide, I'm going to bring on Dr. Kendall Cortelyou, PhD, Director of Data and Analytics. Kendall, are you there?
I am. Hi, Andre. Thank you for having me.
Wonderful. Go to the next slide, please, Madison. And we want to dive in and talk about, Kendall, we've talked about leaders needing to come together and work together because of these overdoses. You were in Santa Barbara, California, with some leaders who are doing a Project Opioid. I was in Central Florida today with some leaders doing a Project Opioid. Really, there's a new need for people to work together at a community level because deaths have not gone down, they've actually skyrocketed. So let's go ahead and let you dive into your data. Madison, go ahead and move to the next slide. Talk us through, where are these deaths right now in America?
They have, Andre, we've seen a steady increase in overdose deaths in the United States, dating back really to the beginning of this issue. But in 2017, this was declared a public health emergency. And since that time, we've just seen the number of deaths continue to rise. The latest data shows that in 1 year, we had over 105,000 Americans die from an overdose death. And so this is really becoming more and more of an issue. Next slide, please. This really lays out very clearly what we're dealing with in the United States in terms of our rise in overdose deaths. So since 2015, we've had 110% increase in these overdose deaths, and it's just continuing to climb. So we are really seeing the escalation go much quicker. If you look around May of 2020 is when things really started to spike in the US.
And Kendall, for those that haven't looked at these numbers year over year for a long time, the numbers from 2001, 20 years ago, were only roughly 15 to 17,000 deaths, right?
Right, absolutely. When in 2001, 2002, we were really talking about a very small percentage of what we're dealing with now. So we've seen the numbers again escalate even after this became a major concern, and definitely a big spike in May of 2020.
Wow.
So next slide, please. I think we can talk a little bit about what this looks like and, kind of how we've gotten here. So this is a demonstration of the amount of prescribing that we're doing in this country. So the amount of opioids that are being prescribed in the United States. If you look, there's two different graphs. One of them is the number of opioid prescriptions from 2006 to 2020. The other is the opioid dispensing rate. So both of these are really showing the same thing, that we did a great job on cracking down on the number of opioids that we have in our community. That was a major problem, especially in some of the Rust Belt states and in the state of Florida, where we had a lot of pill mills. But we have really dramatically cut down on the number of opioids that are being prescribed in our communities. And then up in the upper right, you see that morphine milligram equivalents are a way that we measure the amount, not only the amount of pills, but the strength of those pills that are going out into communities. And that has gone down 60% since 2011. So we've really done a good job of reining in those prescription opioids.
Hey, Kendall, I think some people maybe are not going to fully comprehend what you're saying right now. Even I struggled with this when you first presented me with the data. But you're telling us that since 2018, overdoses in America in almost every state, in almost every community, are up 50, 60, 70%. But prescriptions are down 50 to 60%.
Yes, absolutely. We put a lot of things into place in 2011, 2012. Again, when we were seeing a spike in overdose deaths, there were federal laws, a lot of state laws went into place that really restrict the amount of prescription opioids that are in our communities. So we've done a good job of really reining that in.
Yeah, and we're not going to take a lot of time on this, but if you're, again, a mayor, a county leader, a sheriff, a chief of police, you're president of a hospital, we've got all kinds of attendees today. You got to think about what Kendall is saying, that if you would have asked me 4 years ago, if we cut prescriptions by 60%, will the death rate go up or down? I would have said it would have went down. I would have predicted down. So the idea that prescriptions have been slashed, yet deaths are skyrocketing, that means we're going to have to broaden our policies nationally, statewide, in communities beyond just restricting prescription opioids. we're going to have to look at a lot more than just taking away people's prescriptions to save lives.
Absolutely. I mean, there's obviously still a place to keep people who haven't been exposed to opioids that way. Opioids are a very addictive substance, but there's a lot more to this crisis now. It's a lot more than it was 10 years ago, 5 years ago.
Yeah. And Kendall, again, I don't want to take a ton of time on this because we're going to talk about resources and community strategies, but I will also say that you could make a great case that taking away prescription medications from people without giving them an alternative is reckless. That's reckless policy on the part of communities and countries, our country's policy. So we have, because Kendall, in the last 3 years, we didn't increase medication-assisted treatment by 60%. So, yeah. and cognitive behavioral health didn't go up by 60%. So we got a very interesting moment. Prescriptions down historically, deaths up historically.
Absolutely. Yeah, we are definitely in the middle of, we took away a lot of prescriptions. We didn't have alternatives to people that were dependent on these opioids. We did not have alternatives for them. They, turned to the street, and there they encountered a lot of very, very lethal and dangerous drugs.
So again, I don't want to get off on this. We're going to kill all our time, Kendall, already. Take away all our time. Mayor, county leader, sheriff, chief of police. You can't just take away prescriptions and win this crisis and save lives. We've got to do more than, for years, we all, and it's okay because we overprescribed in a way that was dangerous for years. We've got to go beyond just taking away prescriptions. Okay, I'll get off that soapbox.
Absolutely. And next slide, please. And this is really what the drug crisis has become. So if you look at this is the kinds of drugs that are that people are dying from in the United States. And if you look at that brownish kind of line up at the top, that is synthetic opioids, not including methadone. So this is really fentanyl. So that brown line represents the role that illicit fentanyl has played in the overdose deaths in our country, really back since 2015. Next, please. And you can see it's a little easier to read this graph, but the other one shows you more time. This red line that's shooting straight up is fentanyl and synthetic opioids. And these overdose deaths have increased over 1,000% since 2015 until now. So fentanyl is really the new drug crisis.
Yeah. I think this chart speaks for itself. This number speaks for itself. But, mayor, county leader, sheriff, chief of police, all the folks on this webinar, wherever you are in the United States, your enemy now is fentanyl. Fentanyl is what's killing your kids. It's killing those that if people struggled with drugs before, now fentanyl is making their struggle more deadly than ever. So we've got to have community interventions that think about how deadly these drugs are. And we'll talk about that more in just a minute.
Absolutely. Next slide, please. And then I think the other piece of this changing, kind of evolving opioid crisis that I want to bring up is that it is starting to hit a different segment of our population. So this graph really looks at the percent change in overdose deaths between 2020 and 2019. And you can see that we've seen an increase in younger children, ages 15 to 44, are more likely now to overdose than they were in previous years. The Black population, the Hispanic population are also seeing a greater percent increase in overdose deaths since this crisis has kind of morphed. So this is an important piece to consider when we're talking about education, outreach. These are segments of the population that weren't really as exposed to the prescription drug crisis. Younger people, people in different populations in different areas, but now we're seeing that they are being subjected to the fentanyl crisis.
Yeah, Kendall, I think, again, for another conversation, another day, but what this data screams out, if you look at it closely enough, is that if you were vulnerable before 2018, 2019, when these numbers started creeping up, and now 2020 when they exploded, if you were vulnerable from an economic standpoint, if you lived in a vulnerable community, if you had health issues previously, this increase probably impacted you and your community.
Yep, absolutely. And we just got a great question in the chat. That's a great segue for us. She said, "What can I do as a community leader to help? There are so many struggling in my community, and there are no resources." So, Andre, I think that is a great segue into what leaders can do to actually help this crisis.
Got it. And we're going to hop into that question in just a second. But let me start by, hey, Harry Nelson, are you there? Your slide is up.
I'm here. Hi, Andre. Good to be with you.
Harry, is that the actual background behind you, or is that a screensaver?
No, that's the background. I'm in West Los Angeles. That is Westwood, Los Angeles.
So all of you in Portland in the rain, or in Alaska, there's some folks from Alaska on. If you see Harry Nelson in the sunny LA, don't judge him. Okay, that's just where he lives. So, Harry Nelson, if you do not know him, he is the founder and managing partner of Nelson Hardiman. Nelson Hardiman is one of the predominant healthcare law firms in America. Harry is one of the predominant healthcare attorneys in America. Next slide. Harry is the author of a book. If you have not read this book, The United States of Opioids, go on Amazon right now and pick this book up. I think it's the best book out there in detailing the history of this crisis. There's a lot of books on the opioid crisis, a lot of good books, but if you're really trying to educate yourself on the opioid crisis and how we got to, the death rate where it is now, The United States of Opioids is a great book, and Harry wrote that book. What we're going to do today, though, with Harry is talk about where we were kind of before the pandemic. Harry, The United States of Opioids came out about a year before the pandemic, year and a half.
Yeah, exactly. Early 2019.
Early 2019. And I think when you wrote this book, you thought potentially, I don't want to put words in your mouth, but boy, the opioid crisis is at a historic high.
No question.
Right? And little could we have imagined today in 2022, the numbers of overdose deaths in 2016, 17, 18, boy, those are so small and compared to the lives we're losing now. Next slide, please, Madison. So Harry, I want to talk to you for a second about some of the ideas of the United States of Opioids, and talk a little bit about how we, before the pandemic, got to a place where we had 60, 70,000 deaths.
Sure. Yeah, I mean, I started, just, and for background, as a healthcare lawyer, I sort of saw this issue a little bit differently, working directly with doctors, medical groups, hospitals, and various companies, and addiction treatment, mental health providers. I was seeing it from the provider side, and I was interacting with a lot of government agencies, a lot of interaction with the DEA, with the Medicare program, with the FDA. And what started to bother me was that I noticed like a focus on simple solutions, a lot of talk about pharma, right, about the pharmaceutical industry and companies like Purdue Pharma being the responsible parties, and a lot of blaming doctors. And there certainly was accountability to be reckoned with for doctors and for pharmaceuticals. But what struck me was that this problem is a very complex one that has multiple points of system failure. So one of the goals of my book was to really try to get people to think about the opioid crisis and the overdose crisis more broadly as a bigger problem with a lot of moving parts, meaning we have to ask questions about why the FDA did not do a better job of regulating pharmaceuticals. We have to ask what role our system played in terms of the kind of resources that people need. The opioid crisis, the spike in overdose deaths really dates back to the late 90s. And was continuing as bad as it's gotten, and I know that's one of the themes of this webinar today is the skyrocketing rate post-pandemic. This problem was building on a series of a whole bunch of problems, including pressure on hospitals and doctors to make sure that patients were reporting, happily on their pain, and pressure insurance companies making pills more accessible than other forms of treatment. So there was a lot, from my perspective, this was a multiple point of a system failure problem, and we need to really rethink it. And as much as everybody likes, I hear a lot about things like the Dope Sick series that's on, that everyone's watching streamed on television, blaming drug companies. This is a much deeper, bigger problem that needs attention from all sides.
Hey, Harry, one of the reasons this is important, and again, I encourage all of you let's put a link to his book, The United States of Opioids, in the chat, because I encourage you guys to read that book, because we don't have time to dive into all the details of that book today. But here's why this is so important. If you want to make a boogeyman of Purdue Pharma, which, by the way, these are terrible people and they should all go to jail and lose all their money. So if you wonder my opinion on the Sackler family, they're evil people that should all go to prison. So that's my opinion on the Sacklers. Let me, though, say Harry's point is important, because if Purdue Pharma and a handful of pharmaceutical companies were the whole problem, then now that they're in check, Harry, this should all be fixed, right? So your point is, it was a multiple point system failure that led to this crisis. And what Project Opioid, with your leadership and others, is about is a multiple point system working together the right way to solve it, right? Those same systems have to now go the other direction.
100%. Yeah. And just to add, I know we have a limited time, but it really was, when you look at the last, frankly, you look at the last 100 years of policy, you see this push pull of lots of different pieces and changing views that really makes the scapegoating of whether it's drug companies or doctors sort of a futile exercise, in my view.
Yep. Go to the next slide, Madison, please. And so, Harry, when you talked about multiple points of failure, you just covered a lot of this, but really there were no one was clean when it comes to, whether it was manufacturers or the government agencies that were supposed to make sure overprescribing didn't happen. Doctors, everyone could have done better. There was multiple points of failure. Harry, what is your opinion on how the lawsuits? I'm going to go next slide, please, for the sake of time. I'm going to make sure that we're moving forward. But how do you feel about overprescribing being a big issue, and now underprescribing seems to be, although the data is just coming out, maybe driving people to illegal sources of death? What is your take now on this yo-yo of prescriptions that are happening in America?
My view is that we had our law enforcement, state medical boards, the DEA, and local law enforcement did a tremendous job in the last 20 years of cracking down on pill mills, on abusive prescribing, and that it's not that problem is gone, but that at the same time the net effect was to scare many doctors out of prescribing for people who rightfully need pain medication. And so we are now at a very difficult point, because many physicians who treat pain are frankly afraid to provide medications to people who rightfully need it. And it's a complicated problem, Andre, because we really have multiple populations seeking pain medication, right? We have people who are seeking pain medication for what physicians would consider legitimate needs, people who are really suffering, and then we have people who are seeking for other reasons. It may be mental health, it may be emotional pain. It's a much deeper problem. And how we expect our physicians, our emergency rooms, our medical system to deal with them is an incredibly complex problem, and it's a missing piece. So I think I personally believe we have gone over, when you talk about a 15-year low in prescribing and a skyrocketing overdose rate that we're seeing today, what we really have done is just we've migrated people out of the prescription pill access, but we haven't stopped them from seeking drugs. They're just getting the drugs elsewhere, and they're dying, overdosing, and sadly dying just through a different path. So we've created another one problem by solving one.
One of the questions in the chat, Harry, is question: what is the best use of settlement funds? Next slide, please. There's going to be a lot of conversation about how I'll get to this question in a second, but there's a lot of leaders on here, elected leaders and others, who are, they're going to get some money soon, and what should they do with that money? But Harry, I'll kind of pull these two questions together. We've seen deaths increase. We believe since the pandemic, there's this perfect storm. You and I talk about this all the time. We've reduced prescriptions. Maybe we didn't think through what the alternative was for folks for pain, if they were physically dependent to opioids. We took people's prescriptions away, but we didn't necessarily increase their alternatives, right? And so that, along with really an unprecedented mental health crisis really the pandemic probably ushered in. We already had a mental health crisis. Mental health issues now are at an all-time low, or mental health issues, behavioral health issues at an all-time high. So, but as communities look to invest money, when they think about the death rate, Harry, what do you say to a mayor or a county leader or a sheriff who's got some money now and they see deaths increasing since the pandemic? What is your opinion on investments right now?
Well, so first of all, I'm glad that we're having this conversation. You know, a lot of people looking at the money, and we're talking probably about between 30 and 35 billion dollars coming in nationally over the next few years from the settlements. A lot of people go back to the tobacco settlements where money was not used for treatment and for prevention. It was used to fill holes, frankly, in government budgets, and only a small percentage actually went to treatment and prevention. So what I would say to any local leaders on this webinar is, you know, if you can, there are a zillion holes to plug, right? On the treatment side, the real issue should be focusing on the indigent, on the uninsured, on the underinsured, right? Those are three different groups of people who aren't getting enough through their insurance and need help with treatment. Right. So some of the places where we've seen a lot of attention has been expanding access to things like medication-assisted treatment. Some at the state level, you know, we do need more funding for evidence-based treatment. One of the little pieces of this that doesn't get discussed very often is that prior to the Mental Health Parity Act in 2008 and the Affordable Care Act, we really had very little insurance coverage for addiction treatment. And for many mental health disorders. So substance use disorders have been really under-researched, and we still don't have a great access to effective treatment. And on the treatment side, the last thing I'd say is access to more telehealth, to serve those populations that aren't getting it through their employers and through their insurance. That's a key goal. The second piece that we need to, where the money needs to go, and this is much more, I think, on the ground in communities with law enforcement, and in cities and counties, is on prevention, right? We need more resources on the ground. That includes things like the whole recovery support services for people who are not only at risk, but who have recovered, and just making sure that we are creating resources on the ground so that people don't fall back into this, because the same hopelessness and isolation and emotional pain that leads into addiction doesn't just go away, right? These are real pervasive forces, and supporting organizations who are doing training, for example, distributing Narcan, doing things to engage people around overdose prevention, whether it's the medical side of Narcan or whether it's more broad efforts just to create engagement and address isolation in communities. To me, those are places where I hope dollars will be invested.
Got it. Let's go to the next question, next slide. And Harry, you know, this is something that I know you have researched and done a lot of work in. Fentanyl, which there's a lot of confusion, I think, with fentanyl, because, you know, there is a prescription medical version of fentanyl that is a synthetic opioid, but it's created by Janssen Pharmaceutica. It was created in 1960 for people that are having surgery. That is not the fentanyl that has changed this overdose crisis. The fentanyl that has changed the overdose crisis, and if go to the next slide, I think I have some background on this. You know, those West Point cadets, the smallest amount of this new synthetic opioid fentanyl is what is being put into drugs around the country. As you and I talk about it often, Harry, fentanyl is now replacing all other drugs, cocaine, heroin. It's being put into methamphetamine. The reason this is happening is because it's dirt cheap to produce. And those that are struggling with drugs, they find it to be the most powerful, euphoric drug they've ever used. Go to the next slide. I think we have a couple other examples of where fentanyl is coming in. Many of you have not seen this yet, but much of the rise, Harry, in deaths are coming not from fentanyl, just in cocaine and in heroin. Now it's fake heroin, it's fake cocaine, but now we have a fake pill crisis where if you were looking, Harry, at the pills on the left and on the pills on the right, The ones on the left are authentic. The ones on the right are fake, laced with fentanyl. I would have picked the wrong ones. And next slide, Harry, what we're seeing is a massive increase in fatal doses of fake pills. The DEA recently announced 2 out of 5 of these fake pills with fentanyl contain a lethal dose. Next slide, Madison. I just want to show the audience, look at the increase in fake pills. Harry, again, this is something I know you talk about a lot, that we turned people maybe to the streets by taking away prescriptions without a plan. And suddenly the cartels and drug dealers met that need with a massive amount of new fake pills. And next slide, I just want to show our audience some of how these drugs are made. This is actual footage from Vice of fentanyl being made. You think of a clandestine lab. Fentanyl, much of it's produced outside with broomsticks in pots and pans. Young men in Mexico who die producing it. This drug, Harry, next slide. How is this drug changing this crisis from when, go back one, Madison, we'll wait for that question last. But Harry, how is this fentanyl changing the overdose crisis?
Yeah, fentanyl, first of all, yeah, very important. I would say two things that you, just to reiterate that you said really clearly, this has no relation whatsoever to the pharmaceutical fentanyl, for example, that shows up in like the Duragesic patch that's so popular in hospitals. Also, what you're seeing is really, it's not one drug. Fentanyl is really a category of precursor chemicals that are scentless, and can be and are extremely powerful in small quantities. And so what's happened is a huge number of labs coming out of Asia has been the predominant place, but not exclusively, have been producing the chemicals that you see the people in your video dumping in that white tube, that clear tube. Those chemicals are being made in labs in Asia, coming over to Mexico and Central America for the most part, where you see them being baked in these horrible operations that we're watching, and so it's this category of drugs that's so powerful that it's basically become the biggest profit center in drug in drug illegal drug history, right? So millions and millions of dollars being made on very, very small quantity, low cost, heavily contaminated, filthy drugs that are being counterfeited to look like the drugs that Americans want. And so it's really a weaponized form of these same chemicals that are showing up in our pharmaceutical industry. Really an awful thing. And the challenge here has been that we were not set up at our borders to detect it. We are still playing catch up. And these drugs are proliferated. I saw in one of the comments they're even being laced into cannabis. And so they are everything on our streets is contaminated with them. So in this sense, cutting people off from prescription drugs has just met that supply and demand have met on our streets, resulting in this catastrophe.
We'll talk more with the chief in a few minutes about medication-assisted treatment. I just want you guys to know from the bottom of my heart, this is almost off script a little bit. If you are someone who's been helping folks who are struggling with drugs for more than 10 years, I beg you to rethink abstinence-based models for people who are struggling with fentanyl, because the drugs that, if someone relapse is often a part of recovery, right? But if someone relapses and fentanyl is a part of that relapse, the odds of them overdosing and dying, Harry, are 10 to 20 times what they were just a few years ago. So we have to rethink abstinence-based models. They are dangerous. I know some of you, that's not what you want to hear. We want people just to stop using drugs, and that's it. We want people to not use drugs. We want people ultimately to wind up in a place where they have their life given back to them. But dead people don't recover. So we need to be thinking about, because of these deadly drugs like fentanyl, a new way of thinking about keeping people alive so they have an opportunity to recover. Harry, question 3. what do you make of the lawsuits? You saw J&J settle, you saw certain states are settling. What are these lawsuits, the settlements and the money offer for mayors, leaders, state leaders who are on this webinar? What do you hope happens with these lawsuits and the money?
Look, I'm obviously it's great news that we're going to see this money. As I said, I think the final number will probably, between the 25.5 billion from the Cardinal Health, AmerisourceBergen, Johnson & Johnson and McKesson, and the money coming from the Sacklers, we're probably gonna have about 31, 32. We still have the pharmacy chains, CVS and Walgreens out there. We're probably going to see in total about 33 to 35 billion coming out. And so that's good news. But the problem is when we look at when we talk about what treatment resources we need for people who don't have the resources to get them elsewhere, and what prevention resources we need, it's a drop in the bucket. So somebody asked the question of how do people prioritize where should communities look? And I think I think it's a good question, and I think that hopefully that we'll be able to provide some resources to communities and community leaders to think about how to allocate. But what I would emphasize is I think we have honestly a generational challenge on our hands, so that this money that's coming, there isn't going to be another pool of money like this, right? Those folks mixing the chemicals with the submachine gun, whatever, there's not another pool here like the drug manufacturers and distributors who are going to be. So this is a one-time historic amount, but it's going to have to. We're going to need resources we are in a fight that is a 20 to 30-year fight that is partly in our medical system, partly in our behavioral health system, partly in our communities. It is definitely about law enforcement stopping the supply, as I saw in some of the comments, but it's also about addressing the demand and helping and creating resources in communities so that we can, whatever resources people need, whether it is abstinence-based, whether it is medication-based, we have a lot of needs to meet over many, many years to get this crisis under control.
Harry Nelson, author of The United States of Opioids. Harry, hang out with us. We'll be back to you in just a minute with some questions. Again, if you have a question, put it in the chat box. We will try to get to every question, but the chat box is filling up right now. Let me go to Chief Tom Synan, Chief of Police of Newtown, Ohio. Chief, are you there?
I am here. Thanks for having me.
Chief, you are just a rock star. We've got to know you through Carol Byer recently, and you have done something pretty amazing. Chief Tom, how long have you been the chief of Newtown, Ohio?
For about 15 years, and I've been here for almost 30.
15 years, okay. And I see Semper Fi on your arms. You military?
Marine Corps veterans, so Semper Fi to all my Marines out there.
Okay, well, we love that. And so you're an interesting guy because Marine Corps, you carry a gun, you're a police officer. Yeah, you have some of the most cutting edge ways of helping people in your community instead of criminalizing them. Go to the next slide, please. What's fascinating about, the Hamilton County Addiction Response Coalition, which again, we recruited Chief Tom because our message to leaders out there is build a coalition of the right leaders, have data, and drive solutions that save lives. And Chief Tom is already doing that in a level that's beyond most people. Chief, tell us about the Hamilton County Addiction Response Coalition and why, as a law enforcement officer, are you driving the response in Hamilton to save lives?
Well, sure. So I was also on a SWAT team for 10 years. I was a team leader. So I've seen law enforcement from both perspectives of this trying to go after supply, reduce supply. But I had a pretty tragic incident happen here. I am the police chief of a very small community 11 miles east of downtown Cincinnati. And at the 21-year mark, I'd seen an entire family in my community die from addiction. A mother and all three sons. We literally lost a generation. Those last two boys died from an overdose from heroin and fentanyl. The oldest had 5 children, 3 of which struggle with substance use disorder. One's in long-term recovery, but all 3 use fentanyl. This is middle America, small town America. And I have to say that incident rocked me because as a law enforcement officer, I thought if we went after supply, if we help people, that we can make that difference in the world, we wouldn't have this tragedy. But seeing an entire family die had a pretty big impact. So I met with the president of our Hamilton County Commissioner's Office back in 2014 and said, we need to do something about this. It was a heroin crisis really at the time. And we were dealing with about 20 to 25 overdoses a week. with 1 to 2 people on average dying a week in Cincinnati and Hamilton County. We were calling it an epidemic back then, and we decided to form a coalition. We started with the kind of the standard 4 pillars of treatment, prevention, harm reduction, and what we call interdiction, first responders. But since then, we've expanded to business and faith-based. But really that coalition, even though it was kind of the 4 pillars and we've expanded, there was one thing we did different, and this became critical, was we made sure that the people sitting at the table had to be able to say yes. And that is important, especially when you're talking about a crisis. And if you go to the next slide,
Oh, this is a question. So yeah, here we go.
Yeah, right there. Because we were one of the first cities in the United States to see carfentanil. And we went from 20 to 25 overdoses a week to averaging 50 to 70 a week. We had 70 in a weekend, almost 200 in 1 week, and we would have 40 in a day. It was so critical to have those people at the table who could say yes, so that we could get Narcan to first responders. Hospitals were prepared, open up treatment. So if you're going to build a coalition, one of my biggest things I tell people is make sure that it's people that can say yes, one, to adapt to rapid changing conditions, but also to fill in gaps with the coalition. We started with 12 members. We now have 130 separate organizations and 350 people that are involved in it. And then next slide kind of shows some of the people involved, Andre.
And Chief, as you go through the organizations that are involved, and I again, on May the 19th, Project Opioid is going to be doing our next webinar where we introduce our coalition model, and we really ask mayors, chiefs of police, sheriffs, county leaders, and others to build their own coalition. I know you got some folks working on this, but you need more people. So, Chief, why do you have law enforcement partnering with hospitals and the business community and the faith community? Why all these leaders working together, Chief?
Well, in law enforcement, if we're willing to look at addiction differently, not just as a crime, but as a chronic mental medical health condition, we have a powerful and influential voice that can create and encourage change. And that's what we've been able to do here. And it's interesting you talk about the health and hospitals. One of my best friends on the coalition is the Hamilton County Health Commissioner in the health department. And I got to admit, before we started a coalition, I didn't know what a health commissioner was, but we've become great partners, and working together, we've been able to put in programs to help reduce deaths on the street. But also what that really does is if law enforcement is partnering with health, what it's really doing is shifting the conversation and changing addiction from that crime to that chronic mental medical health condition. And we could be a link to all these pieces that build a continuum care model. Now, here's the thing, because we're not a healthcare system, we're kind of taking these pieces and building a jigsaw puzzle, but we can be that nucleus that helps build that continuous care model, plus change the stigma of addiction. Law enforcement has a powerful voice.
Listen, you carry a gun and a badge, and when you start walking around telling your community that they should help those struggling with drugs instead of put them in jail, I don't know of a more powerful advocate than a person like yourself. And so let me skip ahead, Madison, for the sake of time, skip ahead 2 questions to slide 56, because Chief, a lot of community leaders here. Next question, I want to ask the Chief about the types of programs that you're doing. Chief, you've brought all these people together, you've got some money. What are you doing specifically? All right, Chief, I'm going to hand you $50 million right now. Here's a check for $50 million more. What is your coalition going to do with that money in Newtown?
Well, we are getting close to that. The state of Ohio, and we'll probably get about 13 million of that. And we designed a plan to work on this. And what we're kind of doing is the money was originally intended to go towards how did it impact the beginning, the opiate epidemic. But really what we're going to work on is that infrastructure. And if I could go back and build a coalition a little bit differently, what I would do is have that infrastructure on the back end, the treatment, the recovery. And here's one of the things, and I saw it in the chat. Our coalition doesn't just work on addiction, it's working on homelessness, employment, trying to clear up record expungement so people can get a job, driver's licenses. We have a one-stop resource center where in the past where people would have to go from place to place to place, one, they got to find transportation. Do they even have a car? So we bring everything in one location. You can get your driver's license, you can get your birth certificate so that you can get signed up for Medicaid, you can get assessed for mental health or addiction treatment. We bring all those resources in one place. So what we've done and what we're going to do with that money is we're not just going to fix the holes from the beginning, but we're going to build that infrastructure on the back end. And it's a continuum care model so we can have support on the back end when someone gets into recovery. A lot of times what we do is we get someone into treatment, we say, you graduated, you're back out on the street, but we don't show them the next level or the next step. So our funding is going to be used to build that infrastructure in the back end, create support, and fill in gaps in that continuum care model.
Chief, you got a question here, I think, I'm going to skip ahead and ask this question. Nick Mao, Chief, do you have recommendations on how to approach this conversation with their law enforcement? And this is a loaded question. I think what they're saying is their law enforcement are good people, but are not as supportive as you are of this crisis. What's your recommendation? Nick hears from several of his partners that law enforcement could be better involved. How should someone approach their chief of police or sheriff on this topic?
Well, I think you said something interesting. Think about our tools as law enforcement to deal with addiction: gun, taser, handcuff, and jail. And let me tell you a real quick story about the last brother. He and I had a long history. He was down here. We revived him from an overdose. He said he wanted treatment. He was crying. He didn't want to die. We tried to get him treatment. He refused. You know what my only tool for him was to try to keep him alive for one more night? Was jail. We took him to jail. We accomplished our mission. He stayed alive for one more night. The next day he got out, he overdosed and died. Literally an entire generation gone. So my thing to when we talk about law enforcement is, are we really solving the problem by sending someone to jail? Is that really curing addiction? Actually, I'm going to throw out an argument. It's a little bit different from a law enforcement perspective, but I would say by criminalizing addiction itself, I'm not talking about trafficking or the drugs, but I'm talking about addiction itself. I believe by criminalizing it and putting people in jail instead of treatment, we are the biggest enablers of addiction. Because if we got people into care, if we as law enforcement took them as a link instead of trying to solve the problem ourselves, it is a chronic medical health condition. It's not something that's going to be punished out. So the conversation has to shift. I would go back to law enforcement and say, is what you're doing working? Has it solved the crisis? Do you deal with those people over and over again? If it's not solving a crisis and you deal with them over and over again, then let's try something different. Let's try the medical health side and link them to care.
Hey, Chief, we're going to have to move on in just a second, but you will admit this with me. It is tough being a law enforcement officer in 2022, right? I mean, I defend my law enforcement brethren from this perspective. They got a really tough job to do, and we're asking them to be as compassionate and as effective as you. And so that was, I know I'm preaching to the choir there, but what's kind of the best advice you would give for law enforcement? Now, mind you, let me just say this. We have a huge law enforcement webinar, over 1,000 chiefs of police and sheriffs and others going to be on our webinar on April the 28th with Chief. We're going to have you back on that webinar as well. But what do you think is one thing that you wish every law enforcement officer in America knew from you?
I would say it's not our problem to solve. We don't have the training, knowledge, skill set to solve addiction. And if we need to look at it as a chronic medical health condition, I say we shift our mission set from trying to solve the problem to being a link so that others can continue that continuum care model, that chronic condition. It's not ours to solve. And I think a lot of times in law enforcement, that's what we try to do. But we got to think, we deal with emergencies. We put the Band-Aids on, and then others end up helping to heal that wound and that scar. Look at addiction the same way. We can't put the Band-Aid on it. Link to other places that can do the longer term care, heal it, and then create that scar and then allow them to continue and move on. So be a link instead of trying to solve it.
For those of you that don't know Chief Tom, we're going to put his information in the chat. His community is one of the only we've seen in America that has not had a tremendous increase in deaths in the past 5 years. Chief Tom, thank you. Don't go away yet. We appreciate what you're doing. You are an absolute leader. That's important. Madison, go back to slide 12, please. Go all the way back up to slide 12. Don't worry, you can just pop all the way back there. We've got about 6 minutes left. I want to go back and show you guys something very, very important. It's not at the end of the presentation, so I'm going back. I want to show this to you. When you look at how Chief Tom has impacted his community, if you go back, Madison, to slide 12, it is all about how you can impact this crisis by bringing a coalition of leaders together. Chief Tom could not do this by himself. he needed to do. He didn't call it the Overdose Initiative, but it was a coalition of leaders that were driving change. He led it. He was one of those circles right there. And he decided it could, but chief, it could be a mayor that leads it in their community. It could be a sheriff. It could be the president of a hospital. It could be the pastor of the biggest church. It doesn't matter. But somebody in your community to stand up and fight to build a coalition. And chief, another thing I love from you, you're using data. Data is driving your solutions and you're working together. Now, Madison, go to the next slide. We've only got a few minutes left. I'm gonna try to answer a few questions. This is why you got to have a coalition. May the 19th, we've got to be able to bring leaders together. Our team will put a link in the chat to the May the 19th webinar. Go to the next slide, please, Madison. But in the link to the chat, you'll see the May 19th webinar. And one more slide forward. What is the goal here? The goal is your community able to reach out to those in need from a prevention standpoint, all the way to your emergency rooms and treatment facilities. Next slide, Madison. And then we'll move on to the end. Where did the chief wind up? He wound up bringing his community together, moving money together to help people, coming up with goals, and really making sure people had help when they reached out. So this is what the chief is doing, and this is what we are encouraging leaders. If you're a leader on this webinar, we want to help you. Thank Madison. Sorry, I had to make you go all the way back to this, but you can skip all the way to the end now, and let's show people the final slides, especially in regards to our May 19th webinar. I want to thank Harry Nelson for being on here today. We have 4 minutes left. Harry, you're an incredible voice on this. Questions we want you to answer we're going to help you answer these. Where do we go from here? We want you to join our next webinar. I think that's the next slide. May the 19th. We'll put a link in the chat, but creating best practice solutions. You can't just throw money at things that haven't worked in the past. We've got to be willing to look at modern solutions to keep people alive. Guys, listen, dead people don't recover. So we've got to be able to use harm reduction strategies, medication-assisted treatment, naloxone, to medically keep people alive with our strategies and our investments. Then look at behavioral health, and then look at a societal response. We're going to dive deep into this on May the 19th. Go to the next slide, please. I know we only have a couple minutes left. I also want you to reach out to us. Screenshot this photo. This is my phone number, Kendall, Dr. Kendall's phone number. Carol Byer, if you don't know Carol struggled. Her family has struggled with this crisis. She lost family members to this crisis. She's a tremendous part of our team. Carol, we love you, and we're so thankful for you being on our team. And so Carol's information is there. Please reach out to us. If your community wants to build a coalition, we don't care if you call it Project Opioid, if you call it the Overdose Initiative. We don't care what you call it, but we're here to help you build a coalition. I also want to mention to you that all of the recordings, the recording from today will be available to you and sent in an email in the next 24 hours. And if you're interested in doing Project Opioid, please reach out to us. Also, if you are not the mayor, you're not the sheriff, you're not the county leader, you're not the chief of police, send the May 19th invite and be a bridge builder that brings leaders in that can make a difference. Last thing I want to show you, and this is my final message. I don't know if you guys can see this. Chief, can you see this? Shake your head if you can see this. This is Justin Forrester. Kendall brought this back from Santa Barbara. She was in a meeting of a chief of police and a sheriff building a coalition, a Project Opioid in Santa Barbara, California. And she came back with this family that was there. They had a young 20-year-old, 22-year-old kid who had struggled with opioids, and he ultimately was in rehab doing better. And he had one slip up, one relapse, and fentanyl cost him his life. Guys, this is not about statistics. This is not about charts and graphs. These are real people, young people, beautiful human beings dying every day. But you can do something about this crisis. So I want to thank again, Dr. Kendall Cordew. Thank you to Harry Nelson. Thank you to Chief Thomas. Again, I'm Andre Bailey. I'm the CEO and founder of Project Opioid. Reach out to us. We want to help you build a coalition in your community. May the 19th, we will be back with a new webinar that dives into community strategies. And on April the 28th, we'll get that link. There's a law enforcement webinar. We'll send that link so you can send that to your law enforcement officers in your community. Thank you, everyone. We'll talk to you next month.